Okay, hopefully everyone can hear me and we'll go ahead and get started today. Thanks all of you for joining us today for this session on higher education and the impacts of COVID-19 on our higher education system in Texas and our research universities. We're honored today to have leaders from across our Texas research university community to speak with us and share their experience and their thoughts about this situation and hopefully help us navigate a path forward during this crisis. The speakers that we have with us today, and I'll just briefly mention them in the order that they'll be speaking with us. We have Chancellor James Milliken from the University of Texas System, Renu Khator, the Chancellor of the University of Houston System and President of the University of Houston, Lawrence Scuvenik, the President of Texas Tech University, Mark Barteau, Vice President for Research at Texas A&M University, and Reginald DeRoche, the Provost of Rice University. We're going to have a Q&A at the kind of last half hour of the session. This is a 90-minute session today. So each speaker will have about 10 minutes, and then hopefully right at noon, we'll begin our Q&A. If you have questions for the speakers that you'd like to ask them, please use the Q&A function on Zoom. You can type in your question there, and we'll address those questions and any questions that we received via email during that last half hour of the session. We're really delighted to have this group here and glad we could bring everyone together. And we're honored to have David Daniel, President Emeritus of UT Dallas, TAMEST member from the National Academy of Engineering, and the Vice President of the TAMEST Board to moderate our session today. I'll turn it over to you, David, to tell us a little bit about TAMEST and about the session and begin our program. Thank you so much.
Well, thank you, Terrence, and thanks to all of you for joining us today. Our thoughts this morning are with residents of the Gulf Coast as Hurricane Laura bears down on you, especially for President Couture and Provost DeRoche. I know you're going to have busy days and busy weeks ahead, but we're grateful for all you do and all that our first and emergency responders do to keep us all safe. Today's sponsoring organization is the Academy of Medicine, Engineering, and Science of Texas, known as TAMEST. We support collaboration to advance research, innovation, human talent development, and business in the state of Texas. We're composed of more than 300 members of the 3 national academies: National Academy of Sciences, National Academy of Medicine, and National Academy of Engineering, as well as 11 Nobel laureates in Texas. We're supported by the founders of our endowment, as well as 18 academic and health institutions in Texas. We're grateful for this support and grateful for all that each of them does in advancing the health and vitality of our state. Since the beginning of the pandemic, TAMEST has been convening experts to talk about COVID-19 impacts on a broad range of science-based topics such as vaccines, data analysis, and personal protective equipment. Today's session will focus on higher education impacts from COVID-19, with particular focus on our academic institutions. The pandemic has certainly created challenges, but it has also created opportunities, and we'd like to hear about both. We've convened university leadership to learn how they're navigating the pandemic, what worries them most, and what lasting impacts, both positive and negative, they might anticipate. To get a broad range of perspectives, we have speakers from 5 universities in Texas. Their titles, as Terrence mentioned, include Chancellor, President, Provost, and Vice President for Research, so that we can be sure and cover a range of topics. Each speaker will have 10 minutes for their presentation. I'll hold up the 1-finger mark when you have 1 minute left, but I want you to use all of your time because you have much to share with us today. As Terrence mentioned, we'll have a Q&A session at the end. Please use the Q&A function in Zoom to post your questions. Biographical information about our speakers is available in the session invitation materials. In the interest of time, I won't repeat those bio sketches, but I will say that the 5 speakers we have today are among the most talented university leaders anywhere in the nation. We're so fortunate to have them with us this morning and so grateful for their time. Let's go ahead and begin our session then. Let me introduce our first speaker, J.B. Milliken, Chancellor of the University of Texas System. Chancellor Milliken, welcome.
Thank you, David, and thanks to TAMEST for organizing this event and for all that you do to support Texas. I looked at the list of participants that are going to be with us today. It's impressive and a bit daunting, so I thank you for joining us, and I'm relieved that we have these other outstanding panelists to visit with you. So I'm going to say a few things right off the bat about the impact of COVID immediately, but the most important things that I want to talk about today, I think, and maybe that I hope we follow up on a little bit, this question about why open at all in the fall, and how do you do it in a way that tries to achieve the vital mission of higher education for Texas. And then what are some of the challenges that we face coming out of this period, and what are some of the, maybe the silver linings, if we can call them that. So the first thing is, of course, in March, the fiscal impacts on all of our institutions, our health and our academic institutions, were significant. Our health institutions immediately stopped doing elective surgery and procedures to make sure the healthcare system in Texas wasn't overwhelmed, and we were losing millions of dollars a day. But most important, the non-COVID and non-emergency medical needs were postponed. So we're pleased that we have moved beyond that now and have achieved more of a balance. We, under the governor's leadership, achieved our goal of not overwhelming the healthcare system in the state. As our academic institutions were hit by COVID, there were significant revenue hits immediately. Like most places, we refunded the major expenses like housing, dining, parking, and had thousands of laptops we purchased and other things to meet the needs of our students. You know, another thing though that I'd say that about how our institutions, and I know the others that are participating today, stepped up. You know, we've done 15% of all the COVID testing in the state and have treated just under 20% of the COVID patients. Across our 14 institutions, we've got about 300 different research initiatives underway related to COVID-19, vaccine development, treatments, technology development. So the big change, the most important thing that I want to talk about today is what happened in March with our academic institutions. On the 17th, we announced that they would close to almost all students on campus and finish online. And I have to say that the faculty and the staff and our students did a tremendous job. But this pivot to online education at our institution and others across the country in about 2 weeks' time, I think is going to be remembered as one of the most remarkable feats in modern higher education history. Students stayed on track, they graduated, they continued their progress towards a degree. Now, it wasn't perfect. Moving a lecture to Zoom is not exactly the cutting edge of use of teaching and learning technology, but consider that less than 20% of our faculty had taught a single course online, and less than 40% of our students had taken a single course online. Then that changed to 100% in both categories overnight. So one of the silver linings, and we definitely need some, is that our faculty now are much more interested, those who had no exposure to it, to learning how technology can improve their teaching and the learning of their students in the future. And we did a lot of training on that this summer. Another is that, in my view, students who leave our institutions now are going to have to continue their education and reskilling throughout their careers. So getting comfortable with it now is a great advantage. So the biggest question, if you pick up every newspaper in the country about every day, is the opening of our academic campuses this fall. And the big question on many people's minds is, why open at all? There have been starkly different responses to this question. It's been framed by some as a question of safety versus revenue, as if it were a binary choice and the appropriate choice should be clear. But I don't agree with that. And for a simple reason, higher education is critical to students' opportunity, to their well-being, to their success in life. And for reasons that I'm going to mention, the most vulnerable students, the ones who already face the greatest obstacles to success, would suffer the most in a completely virtual remote environment. So our institutional leaders were unanimous that the best way to ensure that this generation of students doesn't fall behind is to open in a way that does everything possible to ensure the health and safety of our communities while achieving our vital mission. So what are these obstacles? Why is it important that we have some engagement and connectivity? First is the digital divide. This is not just a Texas phenomenon, it's a national one. And a recent survey of high school seniors found that 45% of students from low-income families have home environments that are not supportive of remote learning. In Texas, there are 1.6 million households, which includes the homes of 1 in 5 of our undergraduates, lack reliable internet service. 80,000 of our students are Pell Grant recipients, and for many of them, online-only experience is not a feasible or optimal way to persist towards a degree. We know that low-income, underrepresented, first-generation students are at most risk of not persisting and getting a degree now, and all of those groups are more significantly challenged in a completely online environment. I won't talk about research, I'll leave that to the Vice President, but it's also clear that we have a vital mission in the research enterprise for the nation, and especially affecting our graduate students and our faculty, that we find a way to return and continue that work. So the key to fall opening, the key to being safe, and because I knew I was going to see David Daniel, I visited UT Dallas a week ago Monday on their first day of classes to see how it was going. Each of our campuses has a unique plan because of they're very differently situated, different circumstances, but they all have some commonalities endorsed by our board and our system leadership. They're all going to stop on-campus activities at Thanksgiving break. They all have the kinds of CDC advisory and state health advisory and local health advisory protocols in place that you would expect. Face coverings everywhere, distancing, reduced housing, different dining experiences, all remote and distanced. When I was in Dallas, I got to see the food delivery robots going across campus, one of the innovations, I guess, that comes out of this. With regard to testing, like everyone else, that's part of our safe opening plans. So we're going to do, right now we have the capacity at our academic campuses to do about 5,000 tests a day. And we will probably be increasing that number in the near future. And we have the capacity for contact tracing and isolation. So I want to say a word about the future. So what is it going to look like and how has this impacted it? One of the things that I think we all know is that disruption often leads to innovation. This may be the long promised or threatened disruptive moment in higher education. And we've learned a tremendous amount. My sense of this is that we've taken about 5 years of experience and compressed it into about 6 months. And we're not going to go back to the way we were before. And much of that is very positive. And I'm going to say something about 3 big changes that I see. One is remote work. We moved to almost 100% of our non-patient facing workforce working from home. We learned an extraordinary amount about that. There's a good deal of national research on this that we're learning from, but we're going to be better because of it. And we're going to work differently and more efficiently in the future. Second is education delivery. Just remember my statistics, less than 20% of our faculty taught online, less than 40% of our students. The population in Texas may double in the next 30 years. So we're going to have a much higher student population without the capacity to serve it unless we do it by distance. And so what we're learning now is going to help us enormously to meet the educational needs in Texas. And the third is health delivery. The telemedicine advances during this brief period have been tremendous. I was talking to one of my hospital directors who told me that prior to COVID in February, they did 10 to 15 telemedicine visits a week. They did 2,000 the day before I talked to them. We've done over 400 1,000 telemedicine visits through June. And with a state with the challenging health outcomes that Texas has, that's an amazing change, and one that is going to help us with this doubling of population and becoming a healthier state. So I think there are enormous challenges, but there are some great opportunities for us as well. I look forward to the discussion, and I look forward to hearing from my mentor, Renu Couture, and the other experts today. Thanks very much.
All right, thank you so much, Chancellor Milliken. Our next speaker is Dr. Renu Couture, Chancellor of the University of Houston System and President of the University of Houston. Dr. Couture, welcome.
Thank you, David. Thank you, TAMEST, for having me here. Yes, indeed. Right now, our minds are focused on Laura and how to prepare for it, but at the same time, I'm happy to be here to talk about really something very important. So there are 5 different things I can talk about. Of course, I could talk about finances, but Jim addressed that. Could talk about safety, but we are doing exactly what everybody else is doing. We have a testing site on campus. We have our own contact tracing courses and our own contact tracers and everything else. So I'll leave those two aside. Of course, I can talk about sports, but only if you want to talk about it. So that leaves me with 2 very important topics to talk about, and that is students and its research. As a comprehensive research university for U of H in my president's role, I want to address that because I know the group joining here is important to you. But let's begin with the students because they are our core mission. Very nicely, Jim described why is it's important for us to open our campuses. And I support that, I agree with that. I think we have an obligation to the taxpayers of Texas to make sure that we do our very best and not just throw in the towel, but do it in the absolute safest way possible. So I won't focus on why, let me focus on how we did it, because it is challenging. In our system, we are 98%, we are teaching students right here in Greater Houston, which is apparently huge metropolis. As you can tell, it's larger than 37 states. So I always say that, you know, we really serve the entire state in a way. However, the important thing is in terms of how we do it, we decided early on that we are so different in our populations that we serve, even though we serve within the same city. The important thing for us is going to be to use the flexibility and use compassion. We have done that in our other events that we had, other crises. We did that for hurricanes. This is, by the way, my 3rd hurricane now, and this is my 6th hurricane / storm. And we have always tried to be compassionate and flexible. So if you look at those 2 guide rails, then the question becomes, are there students who do feel that they can come back to campus? Do they want to come to campus? Are there faculty who feel good enough, who feel that they want to come to the classroom? We don't want to drag anybody. So what we did was we actually did the survey of both the students and the faculty, trying to find out what their preferred modality is. And after looking at those surveys, we felt that yes, there was enough substantial group that wanted to have that experience. And so then we completely redesigned everything. We had over 230 classrooms that we retrofitted with all the modern technology for the streaming, at least so that we can have high flex courses. We also make sure the social distancing is there. We make sure that all cleaning protocols are followed. Now, one good thing I will say is, by being in Houston, that our population here, they have been in the big city. So it's not like they are going somewhere away. A whole lot of students are already here. They have been surrounded by restaurants open. They have been surrounded by their friends. And I think over summertime, I hope that they learn how to deal with the crowds and how to behave and how to party. So I sort of am trusting them that they would come here and they would be model citizens. They will do their best. And up to this point, I give a lot of kudos to students. They're doing it, but things of course can change. We continue to have positive campaigning, why it's important. So now that we are open, the students who wanted to be here are here, faculty wanted to be there here, and in case they feel like at any point in time that they feel vulnerable and the situation has changed, they can change their modality. So we continue to do along with that, because I do believe in one thing, that this pandemic has told us how disparity can be absolutely challenging for so many people. I mean, it was mind-boggling how many students were being left out when we immediately switched over 10 days into complete online format. And these people switched to online format, but they didn't have technology. Many of them did not have computers, they did not have broadband. We had to find solutions to all of these. And at that point in time, it became important for us to find solutions to that. But for us, it became a challenging thing.
President Couture, I apologize. I believe you might have accidentally muted
I think it somehow somebody muted me again. So here it is. Here. Okay, I'm unmuted
Okay,
now. All right, I don't know what part we missed, but
we only missed about 10 seconds, so we didn't miss much.
Okay. I just get passionate about it because I've seen it so clearly how people, those who need the face-to-face and those who need the engagement the most, are actually being left out from this whole experiment on online. So we have to pull them along, we have to bring them along, and that's why we felt it was important that we do offer opportunity and we do offer very, very safe environment for our students. We were able to also help, thanks to all the stimulus package and all other kinds of help, the GEAR fund from Texas, that we are able to help thousands of the students, and I hope these students will be ready as we start to really rebuild the economy in a major way, because higher education is going to be important. But now I do want to talk about research, because there are patterns that I have seen in research which I wasn't thinking about before. One of these I've seen now on the positive side, I feel like there's more funding for research available, because we can see more funding is coming to the university. Faculty are putting together strong collaborations, and it's heartening to see that their proposals are multidisciplinary and they are wide-ranging in terms of institutions. I also see how faculty and researchers have swiftly changed their research. They were doing research in energy area, and they were able to shift it to trying to find solutions to COVID-19 situation. I've also seen that there is an increased focus, definitely in infectious diseases, that just states no brainer, but there's also increased attention to and interest in robotics, in automation, in shifting from fossil to alternatives, in cybersecurity, in data analysis. We offered badges and micro-credentialing, and was enormously successful. And I also see that rapid move toward commercialization. So everything we were doing slow, now everything has come on the faster scale, which is really very good. But one other thing which is heartening to see, and this is social entrepreneurship, the research that has really become important and that has been highlighted and focused. And I see our researchers really coming together on that topic, and that is about disparity and social entrepreneurship. So all of those are really good things. Of course, on the negative side, I would say that human subject research has really suffered all of this time. We need to really get to much better normalcy level on that. But I also seen that even though collaborations are happening, strong collaborations, but new collaborations are getting harder to find at this point, simply because we are human beings and we like collaborations, we like face-to-face. So those people we know, it's a lot easier to collaborate with them using technology, but trying to forge new relationship, new trust gets a little harder. I'm also worried about all these push that we see in research, whether it's actually going to continue or it is just the flavor of the month. But at the University of Houston, there are a couple of things which are very interesting other than social entrepreneurship. That inhalable vaccine, there's a work going on. I'm quite excited about that. I'm also really very intrigued by catch and kill filter that our faculty member in engineering has come up with, and it's now hopefully getting to a point where we can find a big solution. And one other area where our researchers are taking a ventilator and trying to see how you can use actually one ventilator for more than one patient so that you can have a much better use. Hopefully we don't need them. We can come up with therapy and then treatment of very quickly, but nonetheless, that is the case. So let me just finish in terms of just saying that Jim talked about the different areas in which the higher education will change forever. Of course, it's going to change in terms of workspace. It will change, of course, in terms of the classrooms. It will change very drastically in terms of HR and how our policies are. I find them to be too rigid right now for our remote learning environment, and we are already looking to see what is it that we can do to take advantage of what we have learned right now. But I think the talent recruitment will also change, and that's where you all, this group definitely can help. You don't need to really find people to now come and move to a certain location. You can actually have them somewhere else. We know we can work effectively with that. So the lot will change, but also I think college sports scene will change too. And I can have another conversation about some time, but I can see that being on the NCAA Board of Governors right now, I can tell you that that thing is coming to change as well. Overall, I would say we all trying our level best. We are trying to, this is right now, the life is about finding, I guess I would say, imperfect solutions to impossible problems. But either we do it, we take the hard path, or we just throw in the towel. And I'm not one of those people who just say, let's just leave it and let's take the easiest path. So our commitment is to our students to make sure that people can come along and learn as long as they feel safe, is to create safe environment, engaging environment to those who want to do it, and just wish us good luck for next 2-3 weeks, because always campus is really, has just a different flavor for first 2-3 weeks. We see more reports, we see more issues. If we can get through 2-3 weeks, I hope that we can find this experiment about face-to-face and online high flex to be a productive model. So thank you very much. I'll stop there.
All right, thank you so much, Dr. Couture. One of the things we've learned at TAMEST is the tremendous motivation the pandemic has created for the scientific, medical, and entrepreneurial enterprise to mobilize. People want to solve the problem. It's really gratifying to learn about the efforts you mentioned, Dr. Couture, and others. We have just extraordinarily talented people, and they're hard at work on this challenge. So thank you again. I'm pleased to introduce Dr. Lawrence Scuvenik, President of Texas Tech University. Dr. Scuvenik, welcome.
Thank you, David.
And I hope you'll talk about athletics. Someone needs to.
I was going to mention that at the very end. I was going to also talk about why we decided to open at the conclusion of my comments, but given that Chancellor Milliken and Chancellor Couture began with that, I'd like to begin there. The way we open reflects input we received from parents and from students. That's why a little over 60% of our courses have some degree of face-to-face. That's why more than 70% of our freshman level courses have some degree of face-to-face. I think students, when they make a choice of a university, they think about the academics, but they also think about the culture. And what is the culture? It's the people. The gold standard of communication, in spite of what we've learned about remote environments and virtual environments, is still face-to-face interaction. And the students want it. I received an email this week from a Spanish professor who was teaching over in an engineering building where everything is laid out very nicely. He was very complimentary of the policies and protocols that were in place. But he said that all I could see of the students were their eyes above their masks. And in those eyes, I could see how excited they were to be back in the classroom interacting with a person. And I think that is something we all understand and appreciate. And how do we do it safely? That we're all dealing with that 24/7. In terms of the impact of COVID-19, what can I say that hasn't been said? It had an immediate impact and a very broad impact over the institution in many ways, financially and non-financially. There's been a confluence of factors that makes this so unique. The closure of businesses, the closure of daycare facilities, K through 12 not being open. And it's created some really unique challenges. And those challenges have resulted in more than just financial issues. There are mental and there are social issues I think we see in our faculty, our staff, and our students. And so it's been really important for us to communicate to our community in a way that shows we're sensitive to all of these stresses they're subjected to. I would say financial, mental, and so on. Both Dr. Couture and the Chancellor have mentioned some of the unique challenges that our student body has faced in terms of technology. We have learned that not everybody has access to the same resources. I think we have to keep in mind as we go forward that especially in rural Texas, there is a lack of technology that has impeded their access to education. And also we have to keep in mind that the students are affected by their extracurricular activities, not being able to work, housing issues, and such. So there's a whole number of issues there that have made this very, very unique. I'd like to say a little bit about more the operational issues we've confronted in terms of research, and then in terms of enrollment management, and even fundraising, and then athletics. To the point that David just made, this pandemic has given universities a chance to really highlight the impact and the power of the scholarship and research that we do. We all could cite a list of initiatives and activities that show a contribution towards addressing the impacts of COVID-19. Somewhat surprisingly to me, proposal activity is way up at Texas Tech. I don't know if that's due to the remote working environment, but I think as we think about funding of research in the future, there's some things we need to be concerned about. We all agree that the federal support for the health issues related to COVID-19 was important to our economy. But in the intermediate period, since research is typically a discretionary, is based on discretionary funding, how can we be assured that research dollars will not be redirected to, as I think Chancellor Couture said, the flavor of the month? Will we be able to make sure that programs that might have temporarily been suspended will still find research support? I think we have to pay a lot of attention to issues related to graduate enrollment and how international enrollment is so important to our graduates, to our research enterprise. I think graduate students, especially international, have felt cut off from their families. Their travel is limited. And I think, and this has been going on for a few years, increasingly they may be choosing to pursue their doctoral degrees at their domestic institutions. And this would have serious impact for STEM education and research in the United States. I'm very proud of the way faculty, in terms of their scholarship and research, have stepped up, whether that's in terms of new research initiatives, providing PEP, laboratory testing. We have a CDC Sentinel laboratory here. It's conducted more than 14,000 tests. It was one of the first laboratories in the state to start doing COVID testing. And the sense of participation and cooperation among the faculty has been wonderful. And that's a message we need to make sure is heard. I'd like to say a few things about enrollment and financial aid. We're all very grateful for the CARES Act funding. More than 21,000 students at Texas Tech benefited from that, but there's been special new pressures put upon offices of financial aid. How they access that CARES funding and how they deal with the usual manner of financial support. There's a lot of tension and pressure out there, and those offices are feeling it. how we recruit students, I think, has been very affected by this. We conducted a survey and found that 85% of the schools that we contacted were not allowing face-to-face visits this fall. So we have gone to a very virtual environment for engaging students and their parents. We adopted a test optional policy in the spring. It wasn't dramatically, it didn't make a dramatic difference in our options, in our applications. But for the cohort of fall 2021, we've seen that over 45% of the students are choosing the test optional policy. And so that requires that we look very carefully at how we now use holistic considerations to make sure we're admitting qualified students who have the potential to succeed. So virtual communication has been a very important part of how we've stayed in contact with students and their families. And I think it's also had an effect on how we stay engaged with our alumni and how it affects fundraising. That's something we haven't, I think, touched on yet. Giving hasn't been affected by the pandemic. And I think that speaks to the wonderful support of our alumni. They want to be heard from, they want to know they can contribute, but we've had to communicate in different ways. Zoom and other technologies, we're all doing it. It's provided for some efficiencies, but again, we all know that the gold standard will be those face-to-face and personal interactions. I will say something about athletics. We've kind of had the perfect storm here. Cancellation of events. We have issues such as the name, image, and likeness, the Alston case versus the NCAA, which some would perceive as threatening the amateur status of collegiate athletics. The financial pressures are enormous. And I think we have to wonder, what will amateur athletics look like in 5 years? Why is that important? Why should we be talking about it? Because that's such an important part of our engagement with alumni. The amount of work that's gone into planning for 25% capacity or whatever you're doing, no tailgating. This is part of the culture that universities have. And students find this very important. And so it's one of those things I think that will play out in the coming years. I think the impact could be very broad and very deep. There's just a few sort of mundane things I'd like to mention in terms of what we have learned. Both Chancellor Milliken and Couture have mentioned this massive transition from face-to-face to whatever we called it. It wasn't truly online. Online has deep pedagogical issues embedded in it that we weren't able to fully follow. But the faculty did a wonderful job, and we know that there will be a larger presence of online delivery. How do we do that without becoming the University of Phoenix? That's not what students want. But I think faculty have become very astute and much more educated about how to deliver quality virtual and remote instruction. But there's other issues we have learned here at Tech.
And Dr. Scuvenik, I'm sorry to interrupt, but
10 minutes.
If you could just wrap up real quickly, that'd be great. Thanks.
Okay, well then, since I said those were mundane issues, I'll stop there.
Wow, okay. Thanks. Well, I couldn't help but think, as a couple of you mentioned that research proposals are up, maybe there was something too. All those years I heard faculty complain about too many administrative burdens on their time. Maybe that's one of the good things, a little bit less time spent on those distractions. Well, thank you, Dr. Scuvenik. Our next speaker is Dr. Mark Barteau, Vice President for Research at Texas A&M University and a member of National Academy of Engineering and TAMEST. Dr. Barteau, welcome.
Thank you. Well, I'm going to focus almost exclusively on research. I would say, to borrow a phrase from Winston Churchill, we're at the end of the beginning. So I will probably get a little deeper into the weeds if there's time. than some of the other speakers, but hopefully there'll be some good ideas there that others might borrow from. Texas A&M is about $1 billion a year research enterprise. And one of the first questions that everybody asks is, so what's COVID costing the research enterprise? The Council on Government Relations just yesterday put out a proposed algorithm for calculating those. I haven't run our numbers yet, but based on some of the earlier guidances, I estimated at about $10 million a month in lost productivity, primarily. But there's some pretty wide error bars on that. That was sort of at the fullest point of the shutdown. During that, we continued, obviously, any research that could be conducted remotely, as well as essential research and COVID-19 related research. We do a lot of animal-based research on campus, and so there were a number of things that were continued basically to, again, care and feed the animals. So we were in that mode for basically 2 full months of April and May. I would say we don't have a clear picture yet of the effect on degree completion and the potential need to extend funding, you know, into or past the end dates of current grants and so forth. And as been mentioned, I think there's been a significant impact on new international student matriculation in graduate programs because they can't get into the country. I think the largest effects there have been on engineering. They have been ameliorated to some extent by fast tracking admission of our graduating seniors into master's programs, since the job market has not been healthy either. That's not going to do much for PhD enrollments down the line. So this summer, we reopened laboratory research at the beginning of June with restrictions on density in laboratories, including shifts as necessary, requirements for mask wearing, hygiene, cleaning, sign-ups for shared equipment and facilities, and so forth. Everyone returning to campus was required to take 2 online trainings. Every PI was required to submit a plan for department or college level approval for resuming safe operations based on guidelines issued from my office. And we did not allow any undergraduates doing on campus to do research over the summer. They are now allowed for the fall semester. We did not do several things that other places did, which was to prioritize any research or researchers other than those doing work directly related to COVID-19. Some of the stepwise plans at other institutions favored untenured faculty, favored students near completion and so forth, and I felt that was just unwieldy. We did not set occupancy limits against the status quo ante because the sort of regular occupancy of laboratories and the density varies widely, so we set it against an absolute standard. And we did not attempt to stage the return centrally. I think this has actually been quite successful. I'm only aware of 4 cases of COVID over the summer among research personnel outside of ag and engineering, which operate somewhat independently. For the fall, we're readmitting undergraduates to research, but the PIs must submit revised plans to include the addition of those to the occupancy of the lab if necessary. Mention was made earlier of the hardest hit fields. One I would like to bring up that we tend to neglect are the humanities and social sciences. And they were hit because of limits on travel and often the end of access or the suspension of access to collections and materials and libraries, including our own library, which was closed. The other, as Chancellor Couture mentioned, was on clinical research and research involving human subjects. Some of that actually shut down in mid-March when we banned visitors to campus and our classes went online. We have been slowly reopening that over the summer. We have required infection control plans for researchers and facilities approved by a university-wide committee. And in looking at those, we've been very conscious of the need not just to protect us from them, the human subjects coming in, but also them from us. And there's an ethical obligation there as well. Our studies that often psychology studies that involved a large number of undergrad participants are only now resuming because only now has the supply of subjects been turned back on. The other big hit, I think, is to the programs we had going on in community or school settings. And many of these are not just information gathering kinds of research, but testing of interventions, classroom teaching, learning methods, and so forth. And, we, depending on what the public schools do, how well they are able to stay open, how well this can be done, or how well even the conditions under which the study assumptions were originally formulated actually bear out, we may lose a full year or maybe even more on some of those projects. There have been some silver linings. I'll mention a few. Talked about proposal activity. We've also received about $17 million at last count in COVID-related funding and supplements. We certainly saw our faculty in engineering and other fields sort of stepping up to do things like producing PPE and other equipment for the healthcare sector. One of the things that we did early on was to form a group called TMAG. So it's TEMAG, Texas Emergency Management Advisory Group. Their website is tmag.tamu.edu. We actually formed this in late January in anticipation of a crisis, you might say. I wish the feds had been quite as quick on the trigger. They are advisory to the Texas Department of Emergency Management and University Leadership. We've got more than 100 folks participating in weekly meetings. One of the consequences of that is making connections, not just among researchers, but really across the spectrum of scholarship and activity in the university that would probably not have happened otherwise. They were instrumental, I think, in really getting us to create mask requirements early on. We imposed those in research laboratories in May. The university was a month after that, and the governor was a month after that. They've also been critical in getting our surveillance testing up and approaching running in collaboration with our new Global Health Research Complex. We've also, again, as was mentioned, seen organizational improvements as we learned about working from home. From the get-go, we emphasized training and career development and professional certification for staff working from home if they weren't fully occupied. It's given us a chance to recognize our animal care workers, and we use 140,000 animals a year for research on our campus. Recognize those as frontline workers. I think the morale of that group is as high as it's ever been, and one of the consequences is they've recognized the need to take responsibility for their personal well-being, because if we have an infection running through the animal caregivers, we have a much bigger problem. And we've also taken the opportunity to break down some silos in the division of research. And we're going to be reassembling some units, research administration and sponsored projects, for example, in some new configurations, both physical and organizational, as people return to work, that I think will be more effective. 1 minute, okay. Let me skip over some of the time sinks. I think communications have been a critical part of this. We launched a COVID-19 webpage for research, communicating guidances and rules and updates frequently, and regular communications with faculty leadership groups. If I look at the future, I think I worry most about the impact on the careers of our younger colleagues, our junior faculty, our postdocs and students. My hope is that, as was said earlier, science will emerge triumphant, that it will be recognized for the lives saved, and that there will be public realization of the importance of science and the investment in it, and listening to scientists. One of my favorite memes from a few months back was a protest where someone was carrying a sign that said, "Every disaster movie starts with the government ignoring a scientist." I also hope that we'll see growth in our recognition of the importance of social science and human behavior. I've served as the director of 2 energy institutes in my career, and I used to tell my colleagues in STEM fields that policy can move the needle a lot faster than any Nobel Prize winning discovery we can make in the laboratory. We're sick. COVID-19 is a perfect example of that. You know, if we could just get people to wear masks, that's going to have a much bigger impact over the term of months to a year than therapeutics and vaccines and the output of research. And so we need to march hand in hand with our colleagues in the social sciences to help get advances and our knowledge in those fields applied just as quickly as science and technology. Thanks.
All right, thank you so much, Dr. Barteau. Our final speaker today is Dr. Reginald DesRoches, Provost at Rice University and a member of the National Academy of Engineering, as well as TAMEST. Dr. DesRoches, welcome.
Great, thank you, David. Can you hear me?
Yes.
Great. Again, thanks for having me on here, and it's a pleasure to be here with this distinguished panel. I've only been provost for a little bit less than 2 months, so I don't know what it's like to be provost when you don't have COVID. And so it's really shaped my short term as provost in this role. Just a little bit about Rice, because I think it is somewhat different from many of the institutions here, at least in terms of size, and that really guides a lot of how we do things and our ability to manage the crisis. So Rice has 4,000 undergraduate students and 3,000 graduate students, around 4,000 faculty and staff. So we have roughly a community of 11,000 people on campus, which I imagine is probably smaller than many of the peers here on this call. We do have a residential college system on campus, and we're located across the street from the Texas Medical Center, and we work closely with them both in the planning for some of our measures as well as now with the testing. We have roughly 11% of our undergraduates are international, 41% of our graduate students are international. And as has been mentioned on this call, we've had some challenges in terms of the international students getting here, as I'm sure many of you have also. One of our fundamental principles that's guided our decision throughout this is prioritizing our community's health and safety while also fulfilling our mission as an institution of higher education and research, and providing the best possible intellectual and social environment in delivering our mission. We truly believe that what we do at the university matters and has a profound impact both on our students and more broadly our community, and I think we've heard that from others on this call also. Coupled with this, we've had a strategy of being flexible, agile, and adaptable, and flexibility in particular is critical in recognizing that both the situation remains highly uncertain and that we'll need to respond to the individual circumstances of our entire community, including students, faculty, as well as our staff. So just a few things on how we've managed and how we're managing the crisis of COVID-19. And we just started classes on Monday, so we're just in week 1. We de-intensified the campus housing. So right now we're roughly 40% of our students are on campus, 40% live off campus in the nearby community, and 20% decided to take their courses completely remote this fall. We normally have 75% of our students living on campus, so nearly half of what we normally would have. We shifted to dual mode, like many on this call, and we provided faculty with the choice of teaching in person or remotely. Roughly 55% of our classes are in dual mode and 45% are completely remote. We have an extensive testing. Again, we're very fortunate to work with many of our partners in the TMC. We're roughly doing 1,000 tests per day. All of our undergraduates are getting tested weekly, and others are getting tested based on a risk profile. So we have a team of researchers on campus that develop the risk profile for every one of our members of our community based on how often they come to campus and who they interact with. And based on that, they are put into a bin where they're tested at a certain frequency. We have isolation and quarantine space on campus. We built 9 semi-permanent structures. You may have seen it, it's been in the news. Some people call them tents. I don't call them tents. They have concrete bases. So they're not quite tents, but they're certainly large structures, semi-permanent structures on campus. And that was just to enable us to have more space to have in-person interaction, both in terms of classes as well as for our students who want to engage in the evenings in student groups and other things. And then as far as our international students are concerned, again, we've had challenges in terms of particularly students from China getting visas. And so we partnered with a university there that we have a strong partnership with, Shenzhen University of Sciences and Technology, SUSTech, where we developed a Go Local program where 70 students, 70 of our students, most of these are incoming freshmen, are going to live there while taking classes, rice classes online in the fall semester, but they'll have their college experience at that local university, be able to go to the dorms and work together and live together, but they'll be taking rice classes while they're there online. And so that was really a great way to provide our students an opportunity to have a college experience, although they're not here. And so, just briefly on the impact on teaching and research, faculty adapted really well in the spring when we had to quickly shift. This summer we put our faculty through extensive training through our Center for Teaching Excellence to help with both the technology as well as the pedagogy to teach in dual mode. As is the case, I'm sure with many of you, some classes transition well online, while others, labs and other things, do not. Research was up for us also. The proposal activity was up both in terms of proposals submitted as well as awards. This was our best year in terms of awards, fiscal year ending June 30th. We established a research fund to support faculty research on COVID, and many of these led to larger projects picked up either by local agencies or national agencies. And one of them is working with the Houston Health Department and Houston Water and collecting wastewater samples from local treatment plants to monitor the presence of COVID. And we also have a faculty member that's working closely with clinicians and researchers at the TMC to develop low-cost point-of-care diagnostic tool, which we believe we'll be able to deploy here on campus in just a few weeks. And so even though we've been across the street from the medical center, this crisis has really forged much stronger and much deeper relationships with clinicians and our scientists and engineers, and in some cases, our social scientists. So in terms of lasting impacts, and not to repeat some of the things that were said here, but clearly we're seeing an increased role of technology for instruction, whether it's flipped or blended learning, more fully online classes, and in some cases, degrees. And I think we're going to see an expectation for choice amongst our students. They want education on demand. I think students love the fact that they can take classes at any time and anywhere. And I think that's going to be a demand that's going to persist and continue to be out there. We also saw an increase in disparities for student learning remotely in the spring. Clearly, our low-income students had challenges with technology, not just technology, but also family situations just didn't enable them to learn optimally. And so that's something we need to figure out and move forward from. And we saw the impact on faculty. I think it was mentioned earlier. Our young faculty, there was a nice study in Nature a few weeks ago that looked at the impact on, particularly on women in bench sciences, as well as faculty with young children, and how they may have lost some things throughout the spring because of the situation that we were in. And so we need to figure out how we accommodate this in the promotion and tenure process for our faculty. And then finally, just rethinking spaces and remote working. One of the things that was a pleasant surprise is really how well these virtual conferences worked. The ability to invite leaders from all over the world at pretty short notice to come and give a talk to thousands of people, and the attendance was incredible. So I think you're going to see that as a mode moving forward, although certainly we'll have face-to-face conferences, but the use of technology for virtual conferences is extremely effective and something that I think will last. And so, David, I'll end right there and we can move to the Q&A.
Let the record show that a fellow civil engineer took less time than anyone else. Way to go, Reggie. Thank you all. Great remarks and much to think about. Some of the questions that have been asked fall in some repeating themes. So I think what I'd like to do is go back through each of our 5 speakers in the same order that you spoke. So Chancellor Milliken, heads up that you'll be first. And I'd like you to address 2 questions, and if you forget them, I'll repeat them. The first one has to do with reduced tuition. The media and student voices talk about the fact that not all services are available when you're learning online. I'm not sure if it's even true that online education is less expensive than in-person delivery, but let me ask each of you to address the question about whether tuition would be reduced, or whether in the long run even it might be reduced if you go to more online aid. And the second question I'd like each of you to address was mentioned particularly I think well by Chancellor Milliken and President Couture, and that had to do with the digital divide and the fact that those undergraduate students least likely to persist and graduate are the ones probably least technologically equipped to deal with that. So again, we'll go through each speaker if you'll take a few minutes. What about tuition, and what about the digital divide? In particular, what do we do about it, not just recognize it's there? So Chancellor Milliken, you're up.
So I answered both of these questions on the chat Q&A, so I hope I'm consistent with my responses. But on the first thing, the question you just posed in the middle of that question, David, is whether it's even cheaper, and it's not. I mean, typically online, high quality online education is not a cost saver. And the reason is that in universities, the principal cost is personnel. And with regard to the academic enterprise, the principal cost is faculty. And I think if you asked faculty members whether they devote more or less time to an online course than they would in person, they'd tell you the former. So, if you have to think through this question, I think, about why it would be cheaper. Now, the great opportunity here is not that we're going to reduce the cost of education, because I don't think if you're doing it well, it's cheaper. But as I said before, the population is going to double. Huge number of young people that aren't going to have access to these great traditional universities, and we're going to have to find other ways to address them. And this capacity is going to help us enormously. Those areas we could cut, Renew, Lawrence, the rest of us, we did. If you're not using your dorm room, if you're not eating from your meal plan, you aren't paying that, but you are getting the education. Second thing on the digital divide, read a story a few months ago in Texas Monthly that basically a third of Texas did not have access to broadband. But when you drill down on that, it's not actual broadband that's available. It breaks down in the last mile. It breaks down on people being able to afford a subscription service and having the hardware necessary. But when you factor that in, it's a huge amount, maybe a third of Texans that don't have it available. But because there are a number of factors, there are a number of solutions. The governor's got a task force on this now. I think that's going to be really important. The key point is that COVID has exposed for us in a new way how important connectivity is for remote work, for K-12 for the first time, and now for higher education. So I think in the new world, there's going to be an impetus to address this question.
Okay, great, thanks. President Couture.
Thank you. So I agree with what Chancellor Milliken said about the issue of tuition, but let me indulge you with an analogy, and please excuse me if you feel that it isn't the right analogy, but if I were to go to a restaurant to take out food, and I go to a good fine dining restaurant, I get the food at the same price. My experience is nowhere same. I'm not getting table, I'm not getting linens, I don't have anybody serving me or any of that. My experience is exactly the same as the experience of curbside at a fast food restaurant. However, and I'm not getting discounts. Why? Because it's the quality of the food, it's the chefing. That's what puts the money. And same thing what Chancellor Milliken said is actually the quality of the faculty. So it's not about the mode of delivery, which is curbside, but it is actually the content. So for me, tuition is important. I mean, tuition is important, high cost, tuition is important, but not because the mode is online, because we still got the same faculty giving the same content. We just have to do more innovation now, and that will happen so that we can combine the two together. So the argument of two connecting is not the right one for me, but the tuition in itself, we ought to be thinking about how is it that we make it more accessible. And I can go into all kinds of things that we are doing And I know UT does the same kind of things, which is, for low-income families or for, others in terms of, assistance. On digital divide, I think this is one time I would say very loudly that what is coming out of public schools, we should be thinking about. I'm really worried because of the online education for public schools. They're not at that same level of maturity. Those kids should not be losing experience because once they do, we get into the problem because we're getting students coming in with that kind of a big gap. So the public schools, it's really important to pay attention for us. We looked at the laptops. UH is a little less problem, but on many of our other campuses in the system, it was a huge proportion of students who really didn't have. We provided laptop, we came up with the solution, and so that the students at least are not, stuck with that, not having even a laptop. But then we had to work also with the Wi-Fi providers to try to see if we can find a good deal. And also we opened our parking lots so people can come actually in parking lots. We have computer labs open, library open. That's why we have to have facilities on campus. Finally, I would say a little more hand-to-hand tutoring. It might open up a totally different door as to how to help some students, how to help them from far away, which is what we are trying to do, but we cannot afford to leave them behind, whether in public schools or whether in our college. So this is another area for innovation. Commit to it and do the right thing. Thank you, Dave.
All right, thank you so much, President Couture. Next, let's hear from President Scuvenik. Tuition and digital divide.
But there's not a whole lot of new information that could be added to what's already been said. But I would just reinforce the idea that online is not cheaper. Personnel is the primary reason, but there's overhead costs. There's issues of ADA compliance that are very significant. I have written to many, many parents who pose that question. I'm not getting the same face-to-face experience. Why don't you reduce tuition? We're not going to reduce tuition, but we have reduced fees. During the summer, we eliminated all campus fees, even though during summer 2, we had some face-to-face instruction. And we also eliminated the online learning distance fee, which we attached to certain courses. This fall, we eliminated the online learning distance fee for courses that would have been traditionally taught in a face-to-face modality. That decision cost us over $11 million. And this is the thing that many in the public don't understand when we deal with these financial issues. We have made lots of accommodations for students this fall based on their academic schedule and how they might be accessing campus services. If they're not in the area, the only fee they pay is library. They have a choice to pay for the rec center. We eliminated the athletic fee completely. And that's, anyway, so I believe that as to the digital divide, again, excellent points have been made. One thing we had to do last spring was begin to distribute hotspots and laptops, hundreds of them. I don't diminish the challenges that students face in urban areas, but there are some unique challenges you find in the sparsely populated areas of West Texas that relate to access to technology and the issues students have. And typically, those who are most challenged are in the lower socioeconomic classes. So there's it's a real issue. It's something we have addressed, but not fully.
All right, thank you so much, Lawrence. We're going to turn to Dr. Brateau, but before we do, Mark, let me ask you to address particularly the international students, because at the MS and PhD level across the US at our great research universities, I'm sure at Texas A&M as well, 50% or more of those graduate students in the physical sciences and engineering are international students. So what about tuition? Any aspect you want to cover, but please do address international students. And what about the digital divide?
Okay, and I was preparing for the first question.
Well, tuition, yeah.
You know, I think we are kind of holding our breath on the international students, right? I mean, we clearly see impacts on the numbers for this year. Like I said, I think we've taken steps to ameliorate some of the tuition impacts, but I think this is longer term going to impact the talent supply into PhD programs. Even if nationally we reverse course on some of these things, I think the reputational damage and the comfort level that international students have in coming to the US is going to take a long time to restore. So I think I don't have a magic solution. I think we're going to have to work our way through it. You know, we would very much like to see a stronger supply of domestic graduate students, especially in PhD programs. And I think that goes to everything that's just been said about K through 12 education, the digital divide, and frankly, the wide disparities almost from town to town and school to school across the United States. And that's something as a society we've been punting on for 60 years. You know, again, I think bridging the digital divide will require this to be seen as a public good. You know, we've been through an extended period where, frankly, higher education was not seen as a public good. It was seen as a private good. I don't know if, you know, we can change the attitude of the taxpayers of the country about that or not. But, you know, it's not a problem that can be solved by the free market and private enterprise. It's going to take a concerted investment at the federal level. And, you know, go back to the last time our economy was in this shape, the Great Depression, you know, we saw things like the Rural Electrification Administration. Maybe we need the Rural Broadband Administration as part of, you know, the 21st Century New Deal.
Okay, excellent. Thank you so much. Dr. DeRoche, tuition and the digital divide.
Yeah, so I think several people have already mentioned, and there's a loud horn in the background, I apologize. Several people have already mentioned the fixed costs and the fact that teaching online is more complicated, more difficult, teaching in dual mode for our faculty to do that. And so one of the things that a misconception out there is that teaching online means you put a class online and you just let it go, but there's a lot more to it, and we actually expect our faculty to engage with the students outside of the online presence, whether it's in small group activity, meeting in person, even now in small groups outside, or having significantly more office hours really to try to get that in-person aspect, even though the class may be online. And I think the real question, which was mentioned several times, is really how do we improve, how do we increase access through the use of online, which I think many of us are now thinking through. Regarding the digital divide, certainly it was clearly an issue for us in the spring for some of our low-income students. We sent them mobile hotspots, we sent them computers in some cases. I think the bigger challenge is how do you deal with the family situations that many of these students deal with, where they may be taking care of younger siblings or just really don't have the environment that lends themselves to being able to adequately focus on studies, which is why we really put a big focus on trying to get those students, have those students remain on campus as long as possible. I'll just add also on the international students, we saw a significant, what we call melt, students that had accepted to come to Rice, but didn't make it here on the first day of class. In some cases, some of our master's programs had 80% melt, particularly if they were heavily from China. And so this is a challenge that we're faced right now, particularly on the master's level. I think we were able to see the numbers we wanted to on the PhD level, but a lot of the master's foreign students were just not able to make it here.
Okay, thank you, Dr. DeRoche. I would just add a couple of observations. All 5 of our university representatives here are from great research universities, some of the best research universities on the planet. And in addition to the cost issue you mentioned of online education, you provide opportunities to students that you just wouldn't get at an all-online university or a purely undergraduate university. And as each of you knows, that's a very, very expensive enterprise. not only for the infrastructure, but for faculty who are fully capable of, leading the world in their field of discovery, which provides invaluable opportunities for students. Another observation is I couldn't help but think of a time I met with an alum and I asked why that university was so valuable to this alum. And he paused for a moment and said, "You taught me a way of thinking." And I think my big concern with online is to make sure that we're not just spoon feeding information, but there's one-on-one interaction with faculty where we teach people a way of thinking and problem solving. That to me is the real gem of higher education. And that means you may be teaching the course online, but there's a lot of one-on-one interaction, perhaps through technology, but still teaching students not just information, but how to discover and so forth. We have just about 5 minutes left, so I think I'd like to cycle back through each of the five of you. Chancellor Milliken, you go first again. Maybe with a 1-minute answer. I know that for each of you, your #1 priority above everything else is keeping your students, your faculty, and your staff safe. So let me ask each of you, what's the 1 or 2 things that you see happening on your campuses that gives you encouragement that we're doing everything we can to keep our students and staff safe? So Chancellor Milliken, let's start with you.
I've read all their plans. They're comprehensive. We spent an enormous amount of time and energy on this with great advice. I've visited our campuses. I've seen our students and our faculty wearing masks, socially distanced. I've seen our lab spaces where the floors are taped so that people can't be in other space. But mainly, I think this is a cultural issue. And I have seen a spirit and a reflection of a culture that we have to respect each other. We have to take responsibility for this. And that if we do that, we can stay safe. And that's really what has to happen, I think, with all the members of our community.
All right, thank you. President Couture.
Well, I did go to campus and I walked around, and out of all the students I saw walking around and the faculty, I only saw one student who was sitting actually in a completely remote area without a mask. Everybody else was wearing a mask. So absolutely, I think that gives me encouragement. I also know, now here comes my sports love for sports, that our athletes, who I believe are safer here with the discipline that we have and all of the things, as opposed to if we let them loose. We do twice a week testing on them, and I wait in great anticipation to see, what's going to come. And they get tested, like if there are 300 student athletes get tested and you get 0 positivity rate, that gives me a whole lot of encouragement. On first day of our classes, we had only 1 complaint that came from either faculty or students, somebody not wearing masks, only 1. So I hope, fingers crossed, we can do it.
Okay, thank you. President Scuvenik.
I have walked around campus more than I usually do to see how people are complying with the standards, and I've been extraordinarily impressed, very proud of our students. I can't say I've just seen one not wearing a mask, but yet I believe there's a great sense of peer pressure and a sense of responsibility students and faculty and staff have displayed to one another. It's very, very encouraging. I think we have to be very careful. We're sitting on a powder keg and we don't know what could happen. Last night, as I was riding my bike around campus, I noticed how many students were meeting in groups outside. We have lots of tents set up, and they're typical student extracurricular activities, but they're meeting in open spaces. I think that's encouraging that they have bought into our need to be respectful and careful so we can stay open.
All right, great. Dr. Bartow.
So I'll tackle this from the point of view of the research community. Certainly when we ramped down research in March and April, there was a fair amount of grumbling about whether or not this is really necessary. As we have reemerged and restarted activities, there has been essentially no pushback about the measures we've implemented. People have been understanding and responsive, and you worry sometimes when the faculty are too quiet. It's like your kids, right? When they're too quiet, you wonder what they're really up to. No, but I think that's a very good sign. I think people really have bought into what we're trying to do to operate safely.
Okay, thanks. Dr. DeRoche, you get the final word.
Yeah, so again, I think we have a great set of measures in place on campus at Rice. Aggressive testing, all the results come in less than 24 hours. So I'm really pleased with all the measures we have in place. But most importantly, I'm encouraged by the students. There's a lot of conversation out there and a lot of things in the media about students not doing the right thing. But I really believe our students want to be here more than anything else. And so every time I've walked around campus, I've seen them socially distanced. I see them wearing their masks. We've been a few cases of students have emailed and said, hey, such and such wasn't wearing their mask. And so they're being responsible. I really believe they know their ability to stay on campus depends on their behavior and the behavior of our entire community. And from what I've seen so far in a few days, it's been great. So I'm hopeful we'll be able to make it through.
Okay, that sounds great. And with those comments, Reggie, I just couldn't help but think if ever one gets down on the world, just go to one of these 5 universities and visit with some of the students. You'll leave a lot more optimistic about the future of our nation and the world. Well, on behalf of TAMEST, I want to thank all of our speakers today. You get an official 2 thumbs up. More if I had more to give you thumbs up. That was such great information. We greatly appreciate your participation. And with that, I'm going to turn it over to Terrence Henry, Executive Director of TAMEST, to give you some more information about today's session and to close things out. Terrence?
Thank you, David, and thanks again to our speakers, Chancellor Milliken, President Couture, President Scuvenik, Vice President Bartow, and Provost DeRoche. We're so grateful for your time today. I know this has been a sea change for our research universities in Texas, and this week you have fall semester starting and storms approaching, so we really appreciate you sharing your insights and experience with our research community in Texas. We're going to spend a session that looks at kind of the wide gap between asymptomatic patients of COVID-19 and those that are hospitalized or in really dire cases die. There's a lot of folks who get COVID-19 who fall in between those 2 broad ends of the spectrum. And so we're going to have a whole session that kind of looks at what the broad spectrum of symptoms are for COVID-19, as well as what some of the long-term impacts might be of contracting COVID-19. Our moderator for that session will be Claire Aldridge. She's the Vice President of Commercialization at UT Southwestern Medical Center and is herself a survivor of COVID-19 who will share her personal story with us. And then we're going to hear from Houston Methodist President and CEO Mark Boom about their experience treating and aiding in the recovery of COVID-19 in their patients. And then we have 2 doctors, Dr. Gupta from Weill Cornell, who leads a COVID-19 recovery clinic in New York, and Dr. Verduzco Gutierrez from UT Health San Antonio, who leads a COVID-19 recovery clinic at UT Health San Antonio. So that session will be on September 9th at 11 a.m. You'll get an invite to that session with a follow-up email tomorrow. In that email tomorrow, you'll also get a link to the video of this session, as well as a link to a survey, which should pop up at the end here as well. We'd love to hear your feedback on this and get any ideas you might have for future topics that TAMEST might convene on as it relates to COVID-19. Wanted to thank again our speakers and moderator and all of you for joining us today. Really appreciate everyone's time and everything that we were able to learn today. We will now conclude a couple minutes early, which is never a bad thing. And I want to thank again everyone for your time. Please stay safe, be well, and that concludes our session for today.